Home care providers say that home COVID-19 vaccinations need to include rigorous measures to prevent the operation itself from becoming a transmission risk. And they add that homebound individuals tend to be elderly and suffering from severe or several chronic illnesses. Now, their comments come after the authorities announced yesterday that home vaccination teams will soon be deployed to broaden vaccine access. Isabel Lim with more.
Mr. Au hasn't been able to leave his house for about a year and a half now.
My leg got no power. I can't walk too long. Inside the house, I go outside, I cannot stand for too long. I got no power on the leg. I need someone to push me on the wheelchair.
And it's primarily people like Mr. Au that recently announced home vaccination operation is targeting. COVID-19 doses will be brought to their doorstep by a team comprising a doctor and a nurse. One group which provides care services to seniors say that homebound persons are generally elderly and above the age of 70. They often live alone.
The general conditions what they have are mobility issues, weakness in the legs, definitely either homebound or semi-ambulant, and they have multiple chronic conditions, mental health, hearing issues, primarily chronic diseases like hypertension, diabetes, stroke, cardiac failure. A few of them are also bedridden and homebound.
Of the more than 7,000 seniors that they engage, they estimate slightly over 400 to be homebound. That's less than 10%. But care providers say that stricter precautions are needed for this group to prevent potential infection. Homage, which has helped out with public vaccinations, says it's important to follow guidelines issued by the likes of the Health Ministry or Agency for Integrated Care.
They do need to be well equipped. So, for example, our entire vaccination team has to be vaccinated themselves and, of course, regularly screened and rigorous screening. They have to ensure that they comply with cross-deployment restrictions. The MOH and AIC formal advisory is not to be deployed to more than 2 sites per day on a daily basis.
But even without restrictions on the number of households that teams can visit, one vaccination provider says that the rate of vaccinations will likely be slow. SATA, which was roped in for mobile vaccinations, estimates that one team will be able to vaccinate only 6 patients per day. That's factoring in travel time, the taking down of detailed medical history, and the 30-minute observation time after vaccination.